The PTF lamented that the fear of COVID-19 among health workers is leading to more avoidable deaths.
We've also seen life-saving maternal, newborn and child health services, routine vaccinations, access to care for chronic conditions such as HIV and other treatments not being delivered in our hospitals. And people need to be able to access care.
New criteria for discharging confirmed cases of COVID-19 were announced.
If you're symptomatic, you can be discharged if you have had 3 days without symptoms, in addition to at least 10 days of symptoms. If you're asymptomatic, we can discharge you. You can be discharged 14 days after your first PCR positive test. So we no longer have to wait for a negative test to discharge. You can be discharged 14 days after your first positive with confidence that you can go home, that you're no longer infective, and you're not at risk you're not putting your family, your friends, or anyone else at risk if you're asymptomatic.
The task force, however, advises against self-medication for COVID-19.
WHO continues to emphasize there is still no evidence that hydroxychloroquine or any other drug is effective in treating or preventing COVID-19.
States and local governments are urged to take ownership of managing the pandemic in their domains.
State oversight of this phase of the response is very critical. The response needs to be decentralized to the local government level, identifying high-burden local governments to rapidly trace, test, and treat cases.
The daily epidemic curve of confirmed cases shows a consistently rising trajectory with corresponding increase in fatalities.
The task force emphasized that it is not a procurement body and does not award contracts, urging the public to beware of fraudsters. In Abuja, Mitaire Ikpen, NTA News.